Did you know your overall health depends on a microscopic layer most people have never heard of? The glycocalyx? Welcome to the future of vascular health. Healthy Vessels, Healthy Future, the podcast dedicated to uncovering the hidden science behind vibrant health, longevity, and vitality. Brought to you by the Glycocalyx Research Institute, each episode delivers cutting-edge insights into microvascular health, empowering you to finally understand why you might be experiencing fatigue, brain fog, or poor circulation, even when your labs seem normal. Through actionable advice and expert interviews, you'll learn how protecting your glycocalyx can significantly improve circulation, support your heart, enhance brain function, and prevent serious vascular issues before they begin. Tune in weekly and discover how healthy vessels today create a healthier, brighter future tomorrow.
Hello and welcome everybody to a special Thursday evening edition of the Boston BioLife Live Q&A. This has become a more popular segment. Today we have a very wonderful guest, Vink and Jolynn Beaver, and they're going to be talking about groundbreaking MACE study, the role of the Glycocalyx device in predicting cardiovascular events. We've been working with Hans now, I think, for 7 years, and Bob Long and their group. We really haven't found any place that this doesn't have relevance. And I think as we get deeper into the world of functional medicine, looking at fundamentals, and people talk about things like root cause and gut dysbiosis and the microbiome, all of it leads to vascularity at some point in time, at some way along the journey. And I think you can have all the best medicine in the world, you can have the best regimens and routines and therapies, etc. We're lucky because these are evolving. There's a lot of patient demand for these technologies. But really, at the end of the day, the problems are complicated, the solutions are simple, and we know a solid vascular system is so important to everything we're doing. And these professionals are dedicated to providing you tools, biomarkers, if you will, and techniques and technologies to help ensure that patients have the best opportunity to have the strongest vascular system. So Joelyn and Hans, thank you so much for being here with us. We really look forward to this wonderful presentation. So thank you very much for being here with us. We really appreciate Glycocalyx's commitment to Boston BioLife education and all the wonderful things that you do.
All right. Thank you so much, Joe and Mike, for another opportunity to present some of the exciting new glycocalyx research that we have been doing in collaboration with other people. Today, I would like to focus on the study done by a group led by Professor Economides in Greece. It's called the MACE study, in short. There's a longer title that says they looked at measuring glycocalyx as a potential predictive new marker to predict in people that don't have cardiovascular disease who will get a heart attack or a stroke or will suffer from cardiovascular-related death. So actually, it's the first time that people have been looking with the GlycoCheck device, measuring glycocalyx health in healthy individuals to see if they can predict things happening in the future during a 6-year follow-up. So over the years, I have been privileged to present some of our glycocalyx research and GlycoCheck stuff to the Boston BioLife audience, but not all of you might have seen those presentations. So I'm going to give a little bit of a background introduction on what is glycocalyx, how do we measure glycocalyx damage with the GlycoCheck device, and then some of the other studies showing that it correlates breakdown of your glycocalyx with impaired vascular health in different risk groups, people with diabetes, people with heart disease, people with strokes, and then finish with some of those new data on using the GlycoCheck to measure glycocalyx damage and cardiovascular risk as a predictor of events in different patient groups. So with that, I'll move on to the next slide. Again, showing an image of the cardiovascular system. So most people know the image on the left, with heart and the large arteries taking blood to the organs and veins taking the blood back to the heart. But not everybody realizes that all those large vessels only make up like 1% of your cardiovascular system. If you zoom in at the organ level with a microscope, you'll see that those large arteries will branch in smaller and smaller vessels that become so small, at some point they're actually too small for red cells to fit in. Red cells individually have to be squeezed into individual microvessels called capillaries, and at that level is where all the nutrients and oxygen is being delivered to your organs. So breakdown of that microvascular system will have a great impact of the health of individual organs. So if we further zoom in on those microvessels, so this is one of those tiny microvessels with a diameter of only 4 to 5 microns. And you see these little black dots flowing in the center of this microvessel in this capillary. And those are individual red blood cells, one by one, squeezed into this tiny tube. And what surprised us when we started looking at this already 3 decades ago is that those red cells don't touch the wall of these tiny blood vessels. There's this significant gap between the endothelium that makes up the wall of these tiny microvessels and the center where those red cells are flowing. And it turns out this space in between where the red cells are flowing and the anatomical surface of the wall is not just fluid, there's this protective gel-like compartment growing on the inside of your vessels. It's really important to keep your blood vessels healthy. So when we zoom in with an even bigger microscope, we get these kinds of images to show what's really growing on the inside of your vessels, keeping your red cells in the center and preventing them from touch the wall itself. This is a cross-section of a small capillary in myocardial tissue in the heart. On the right-hand side is a larger magnification. So on top would be where the red blood cells are flowing. Here on the bottom is the endothelium, so the cell that makes up the wall of these tiny capillaries. So you can appreciate these bush-like structures extending from the surface of the endothelium attached to the membrane, really extending into the lumen of these blood vessels. And you can appreciate the size of this three-dimensional mesh of polysaccharides, so heparan sulfide-like molecules or hyaluronic acid attached to the membrane and extending up to a micron or more into the lumen of these blood vessels, while the whole endothelial cells are only like 1/10 or 2/10 of a micron. So this bush-like structure called glycocalyx is several times thicker than the whole endothelial cell itself. So you can imagine it has an important impact, huge impact on the functioning of that endothelium. Healthy endothelium is essential to keep your blood vessels healthy. So over the years, we look at many different complications when glycocalyx is damaged and how it results in cardiovascular disease. And one of the complications is shown here in large arteries, where we know at specific locations you can have atherosclerosis, so the leakage of cholesterol forming cholesterol or atherosclerotic plaques in the vessel wall. We know exactly at these sites where those lesions develop, where cholesterol starts leaking into the vessel wall. That only happens at these sites where glycocalyx is very thin. So those sites, for some reason, have a very thin glycocalyx, and that makes these sites very vulnerable for cholesterol leakage and the start of atherosclerosis. Well, over the last couple of decades, we've looked at many different risk factors and see what kind of impact they have on glycocalyx and what is the functional consequence of a damaged glycocalyx when that happens. So in a healthy situation on the left, we have a very thick glycocalyx in a healthy blood vessel here on top of the endothelium. And we know now that a healthy glycocalyx will prevent red cells from touching the wall. So red cells won't stick to the wall, but also other circulating cells like blood platelets, important for blood coagulation, don't stick to the wall if there's a healthy glycocalyx. And also inflammatory cells, immune cells like leukocytes will not stick to the wall when there's a healthy glycocalyx. And the reason they don't stick to the wall is that the adhesion molecules that they need to connect with to stick to the wall are presented on the endothelium, but those are very small compared to the size of glycocalyx. So these adhesion molecules are only like 10 or 20 nanometers long. Glycocalyx is about 100 times thicker than the size of these adhesion molecules. So as long as glycocalyx is intact, forming a stable mechanical gel that prevents circulating cells to get too close to the endothelium, that will prevent blood clotting and that will prevent local inflammatory responses. Well, in addition to preventing cells to stick to the wall, glycocalyx is super important to tell the endothelium that blood is flowing over its surface. So these structures will bend forward, act as a lever, amplifying the shear forces of flowing blood, telling the endothelium to start producing nitric oxide. And we know nitric oxide is a very important protective gas that helps to dilate blood vessels, increasing blood flow, but also preventing inflammatory damage. So glycocalyx needs to be there to tell the endothelium, please make more nitric oxide. At the same time, also within glycocalyx are binding sites. So glycocalyx is negatively charged. Some of the proteins and enzymes in the blood are positively charged and will bind to a specific binding site within glycocalyx. And of these molecules, for instance, some antioxidant enzymes like superoxide dismutase specifically bind within glycocalyx, scavenging oxygen radicals, inactivating them, preventing vascular damage. So together with producing nitric oxide, it's telling the endothelium to produce nitric oxide, glycocalyx will, by binding of these superoxide dismutase enzymes prevent oxidative stress mediated damage. And then at last also, because of the tight nature of these polysaccharides, they are very close together. The openings between the individual polysaccharides are only a few nanometers, which is much smaller than most of the size of most plasma proteins like albumin, and especially cholesterol is a huge molecule compared to the size or the gaps in the effective pore openings between the polysaccharides. So an intact glycocalyx will prevent leakage of plasma proteins and thereby preventing edema formation and leakage of fluid, but also preventing cholesterol accumulation in the vessel wall and preventing atherosclerosis. And on the right-hand side, you see all the known risk factors that we have looked at, and many others with us in the past, like smoking or diabetes or hypertension or aging or some genetic predisposition, will damage glycocalyx first, and that will trigger down the road all kinds of vascular complications like less production of nitric oxide causing hypertension, leakage of plasma proteins or cholesterol causing atherosclerosis or edema, and then sticking of platelets causing clotting disorders, and leukocyte causing all kinds of inflammatory disorders. So that's what we have been studying over the decades, past decades. I'm not going to show you a few, examples in different patient populations. But first, I'm going to introduce you the GlycoCheck device that we are using, and that also the group in Greece that did the MACE study have been using to measure whether you have a healthy microvasculature or whether you have a glycocalyx problem. So the GlycoCheck device is based on a patented method to measure the health of glycocalyx by looking how the red cells are flowing in the center of those capillaries. So if they don't touch the endothelium, you have a healthy glycocalyx. If they punch holes in your glycocalyx, they get closer to your endothelium, you have a damaged glycocalyx. That's basically the method. That's the core of the GlycoCheck system. And then we have a small handheld video microscope that you can put in your mouth, and on the bottom of your mouth you can look live how red cells are flowing through your capillaries.
Are you feeling tired, foggy, or noticing poor circulation despite doing everything right? The answer might be hidden in your microvascular health. Introducing Revasca and Renew, two groundbreaking supplements scientifically designed to restore and protect your vascular foundation. Revasca revitalizes your circulation, supports heart health, and naturally boosts your energy by repairing your blood vessel lining, the glycocalyx. Renew complements this by providing deep cellular repair, resilience against stress, toxins, and inflammation, and enhancing your overall vitality. Together, Revasca and Renew offer the complete solution for lasting health from the inside out. Visit glycocalyx.com today to learn more about how these powerful supplements can help you reclaim vibrant health and lasting energy.
And then the software of the GlycoCheck system automatically identifies all these small capillaries and measures in thousands of vessels how close the red cells can actually approach the endothelium, how deep they can penetrate into glycocalyx as a measure of glycocalyx damage. And that's the system that's been used by this group that did the MACE study that we'll get to in a couple of minutes. So this is just a slide showing that the GlycoCheck system has been purchased and used in many different academic hospitals all over the world that we are working with. More than 100 different institutions are doing clinical studies using the GlycoCheck device. And here in the circle, just identifying the group in Greece, in Athens, that we have been collaborating with for already, I guess, more than a decade or maybe 15 years already. They were one of the earliest collaborators, and we have published many papers together, led by Ignatios Ikonomidis, is a good friend nowadays, and he does some wonderful studies that will show you some of those data in a minute. Well, this is an example of the kind of video that you will see if you put the GlycoCheck video microscope in your mouth. You see all these little black dots, which are individual red blood cells flowing through your microvessels. So we're looking at microvessels ranging from the tiniest capillaries of 4 microns in diameter up to vessels of 25 microns in diameter. And the group of Ignatios Ikonomidis looked at all these different vessels, all these different diameters, and then measured whether glycocalyx was healthy or compromised, and then separated people in a high-risk group if their glycocalyx was compromised compared with a low-risk group if they had a healthy microvasculature, and then did a 6-year follow-up to see what happens in the different groups. Do you have a higher risk of a heart attack or a stroke when you are in a group with a compromised glycocalyx or not? So we'll find out shortly. So as I explained before, the way that we do measure glycocalyx damage is we look at the red cell positions in individual capillaries. So we measure the red cell position approximately 1,000 times in each microvessel, and we measure hundreds of thousands of microvessels. So if you have a healthy microvasculature, the red cells stay close together in the center. They don't touch the endothelium. If your glycocalyx is compromised, they just penetrate a little bit deeper into glycocalyx and get a little bit closer to your endothelium. So how deep those red cells penetrate in glycocalyx, we call the perfused boundary region, or PBR. It's our measure of glycocalyx damage. Higher levels of PBR means deeper penetration of red cells into glycocalyx, more glycocalyx damage. Well, a few examples. So I mentioned before, in the past, we did already do a lot of studies in different patient groups, see if there's a correlation between their specific cardiovascular issue in this patient group and whether glycocalyx is damaged or not. This was a study done in people with early onset of type 2 diabetes. So if you look at glycocalyx damage, that PBR value, so low value means a healthy glycocalyx, higher values mean more damage to your glycocalyx. So on the left was a young control group. So we had 2 visits and then an average of the 2 visits. So a PBR value of 1.8 is considered a low value. So that's a healthy glycocalyx. If you look at healthy individuals that are a little bit older, you see that PBR values increase like 1/10 of a micron. So your glycocalyx breaks down by 1/10 of a micron, which is relatively small amount of breakdown, but already can have some significant functional consequences. And a little bit more breakdown of your glycocalyx in a similar age people with type 2 diabetes, even before the onset of obvious cardiovascular complications. So glycocalyx is damaged in people with diabetes. Another example, this is in cardiology patients with chest pain, angina. So compared with similar age healthy controls, we see that the 2 subsets of people with chest pain both have increased levels of glycocalyx damage. So the one in the middle is your classical patient with a large vessel blockage. So if you look at the lumen of these larger vessels, put in a wire, see if there's blockages. Now, these people not only have a blockage, but they also have a compromised glycocalyx in the rest of their vasculature. But nowadays, we know that many of the patients showing up at the cardiologist's office with chest pain, they don't even have blockages of large arteries. So most of them actually have microvascular disease, also called syndrome X. And all these patients that have impaired blood perfusion of the heart because of microvascular disease also have a compromised glycocalyx. So one more, this is a study that we did in the past on stroke. People with stroke, and if they on their MRI scan of the brain, you see all these little white spots that are suggesting that there might be a microvascular disease causing the stroke issues of this patient. So those are the ones on the right, what we call with distributed white matter lesions, all these little white spots, lesions on the MRI scans of the brain. So these stroke individuals have significant increases in glycocalyx damage and microvascular disease. So this was not very surprising, but it's good to get confirmation in different studies. So in different patient groups, when they do have an issue, they have chest pain or getting a heart attack or they have a stroke. The ones that do get a heart attack and a stroke, they all have a compromised glycocalyx. So, but the more important question is it just a correlation? Is it just going together with whatever is causing the real problems? Or does it start much earlier in the process? Your glycocalyx breaks down, and is that a cause of the problems that people will have years later leading to a heart attack or a stroke? Well, we don't know yet. So one thing that we do know is that people, when they are really sick and they end up in the ICU, for instance, with an infection like COVID or sepsis, you need a healthy glycocalyx to survive your stay in the ICU. So these are 2 subgroups of people with COVID or sepsis staying for up to 2 months in the ICU. And then we just measured how many of these people will survive their stay in the ICU. And they made 2 subgroups. Then the blue line are patients with a relatively healthy glycocalyx. So their PBR values are the lowest of the whole group in the ICU. Still a little bit elevated compared to healthy controls, but the ones with PBR values smaller than 2.3 microns were considered the ones with a healthy glycocalyx. And in patients with a much higher PBR value, so higher levels of glycocalyx damage, were the risk group. And you can appreciate the ones with a relatively healthy glycocalyx, even staying up to 2 months in the ICU with severe issues of COVID or sepsis, they all survive their stay in the ICU. But the ones with more compromised glycocalyx, the longer they stay in the ICU, the lower their chances of survival due to a very high risk of organ complications, or their heart will shut down, or their kidneys will shut down, or they get a stroke or something that causes real damage in these individuals. That already was an indication that the level of damage of your glycocalyx will predict outcome on the short term. Another study that's ongoing as we speak, predicting risk in the future, is a study on cancer patients. So this is a collaboration with a group in Italy. These are cancer patients that are getting radiation therapy, and they wanted to know whether a healthy microvasculature will also protect you against the toxic side effects of the radiation therapy. So they took all of their cancer patients before the radiation, put them in a group with a compromised glycocalyx, so a low microvascular health score, which is equivalent to a poor glycocalyx, or a medium level of glycocalyx health, or people with a good microvascular health and a very low level of glycocalyx damage. And on the vertical axis is the percentage of patients in these three groups that develop toxic side effects of the radiation therapy. And they showed if you have a damaged glycocalyx and a compromised microvascular health, 50% of the patients in that group got all kinds of toxic side effects of the radiation therapy. The medium microvascular health, only 20% or 25% of the patients got toxic side effects. And the ones with a really good microvascular health, so very little damage of their glycocalyx, 0% of their patients, these patients had toxic side effects. So also showing that a healthy microvasculature and a healthy glycocalyx will protect you against future challenges. So the real study that we wanted to present you today is this study published a couple of years ago by Ignatios Economides, and they set out to investigate in 600 healthy individuals without cardiovascular disease at the start of the study. If we measure glycocalyx health, does it help us to predict which of these individuals will get a heart attack or a stroke in the next 6 years of follow-up? So they did a lot of follow-up, so they started doing measurements on these people in 2013, and then did follow-ups at 1 month, 3 months, and 6 months, and then once every year. And after 6 years, they just looked at how many of these people got a heart attack or a stroke or did pass away because of cardiovascular disease, and does it correlate with glycocalyx damage? And thus, measuring glycocalyx damage has that additional predictive value on top of all the other risk factors that we know, like cholesterol or smoking or diabetes or using antihypertensive medication. So does it have additive value if you correct for all these known risk factors? So this slide, actually, it might be a little bit small, but I'll take you through the selection process of the study that they did. So they started out initially with 688 individuals that were referred to the cardiology department in the hospital. They're all healthy. They wanted to do a health checkup to see if they're in good shape. Then of the 688, there were 59 patients that were excluded from the study because of different reasons. Some of them had already cardiovascular disease. Some had peripheral artery disease, so an occlusion in an arm or a leg or in the kidney, for instance. Some of them already had strokes. Some of them already had heart failure. Some of them already had type 2 diabetes. And some of them were already using anti-diabetic or antihypertensive or lipid-lowering medications before the study started. And some of them just didn't want to participate in the study. So out of the 688, 59 could not participate. Then we started out with 629 individuals, and then during the 6 years follow-up, 29 of them did not show up for their appointment, so were excluded from the study, and that left us with 600 people that completed the whole 6 years. And out of these 600 people, 543 people, nothing happened. That's a good thing. So already earlier, there was a prediction that about 10% or so would get an impact based on known statistics. And indeed, out of the 600, 57 people got a problem. Either they died because of cardiovascular disease, so 11 people died, 32 people got a heart attack, and 14 people got a stroke. So next steps were, now if you look at these 57 individuals, could we predict that these were people getting a heart attack or a stroke 6 years ago based on glycocalyx measurements?
Thanks for listening to the Future of Vascular Health. Healthy vessels, healthy future. Ready to uncover what's really going on beneath the surface of your health? Take our quick Revasca quiz today. Discover how well your glycocalyx, the crucial microscopic lining of your blood vessels, is functioning. Revasca isn't just another supplement. It's a scientifically backed solution designed to naturally strengthen your vascular health from the inside out. Say goodbye to persistent fatigue, brain fog, and circulation issues. Say hello to lasting energy, clear thinking, and vibrant health. Go to www.revascaquiz.com now to take the Revasca quiz and start your journey toward better health today. Because protecting your glycocalyx means protecting your future.